Hi, did you know that you also need to pay attention to micronutrients when you're trying to lose weight? It's not all about the macros, the carbs, food, fats, and protein, which are the energy sources. You also need to have an idea about the micronutrients that are essential for the body to make the body run well. So, this is also an important part of a healthy weight loss program that we practice here. I'm Dr. Indrani Raman. I'm the founder of Excel Health MD. We have a holistic weight loss program where our patients are routinely monitored for these lab parameters to have the micronutrients also supplemented during their weight loss program with us. And I really wanted to bring this knowledge out to you. Before I start, let me just give you guys a test. I have a prop here, and I want you to figure out what kind of animal is on my hat here. Um, with the COVID and all, we've been wearing a lot of PPE, and this is my cap, scrub cap. So I wanted to figure out what kind of animal is on here. And if you either see it right now live or even watch the replay later, post the animal name in the comment section, and I will send you a copy of the show notes. How about that? So let's get started. So macro means big, and these are the big nutrients that you need for energy sources, and that would be your fats, your carbs, and proteins. Micronutrients, as the name says, are micro. We don't need them all the time. These are things that are needed in small amounts, and these are the vitamins and minerals. And of course, there is also phytonutrients that we need, which come from the plants. So those are all the different sources. And I'm not going to go down the laundry list of all the vitamins and minerals that we need, but I'm going to just focus this time only for the next 10-15 minutes or so, mainly the top vitamins and minerals that you need, especially when you're doing a healthy weight loss program. The reason we need to know is that these are not, our body is not able to produce them on their own. So it is really essential that you are able to get them through your dietary sources, mainly through the foods you eat, and especially if you're doing a weight loss program. If you are not being conscious of this and you're just doing this by cutting down calories, you may get deficient in this, and you may not have the adequate weight loss program, or worse, even you may even get the deficiency, those things, and they all have different syndromes and diseases that can cause if you're deficient on those. So let's start with the first one here. That is our vitamin D. So there were several studies that have shown that low levels of vitamin D has shown some increased risk of cardiovascular disease, and especially if you have high blood pressure. It's really important. There were several studies which are showing that when vitamin D was repleted for people, they did have an improvement up to 6 millimeters improvement in systolic blood pressure, and up to 6 millimeters improvement in diastolic blood pressure. So if you have high blood pressure or cardiac disease, or even otherwise, you really need to have vitamin D as an essential part of your diet. It's also important mainly for immune system. It's also important for calcium absorption and also for bone health. There are guidelines. The National Institute of Health recommends a guideline of minimum health benefits with a vitamin D level of 30 nanograms per ml. But this may not be an essential, this may not be enough for optimal health. In functional medicine, we really recommend anybody to be above a 50 nanograms per ml of vitamin D, and you can even go up to 89 nanograms per ml. This supplementation should always be adjusted by checking your vitamin D levels, 25-hydroxy vitamin D levels, and they should be followed by your doctor, and until you obtain the therapeutic levels. In our program, I do that. On the first visit, we check their vitamin D levels, and then we kind of start them on a supplement, and it's monitored periodically until I see they range between 50 to 80 nanograms or so. You, of course, don't need to be taking this as a supplement if you're getting enough in the food sources, especially dairy products, and even some fortified non-dairy products too, like almond milk and cheese and mushrooms and even fish, and also, of course, the sunlight. All of those things can help you with increasing your vitamin D levels. If you're deficient, you can start first with over-the-counter vitamin D3, which can be, you can take anywhere from 1,000 to 5,000 international units per day. Or in prescription, we do D2, which is like 50,000 units or so. And it definitely needs to be followed up by your doctor until the desired level is obtained. I do want to make it clear that I am not giving any medical advice here, and this is only for information purpose only. Definitely always check with your own doctor and with your own provider on what is needed for you and your own case. And you're always welcome to see us to make an appointment in my practice. So vitamin D is really well tolerated. It's a fat soluble vitamin, but people can have toxicity with it. And if you get high doses of vitamin D and the levels are not monitored, people can have high calcium levels and also can have risk of kidney stones. And that can present as more like a fatigue, nausea, vomiting, dryness of the mouth, and so this can be one of the factors that needs to be monitored. That's why it's important to check the levels periodically. So you do need to have vitamin D adequate levels if you want to improve your metabolic health, and it's essential, especially during weight loss time. Okay. So the next micronutrient I really think is the most important of all this is magnesium. It's really important for so many cellular functions and energy metabolism and the cell transportation process. It's needed to move the potassium and the calcium ions in and out. It's any deficiencies of magnesium can present as problems with your irregular heartbeat. Other than also symptoms with muscle aches and also overall weakness. It's also an important essential factor that's needed for so many enzymes, and it's needed in the carbohydrate and lipid metabolism. So if people are low, there are several studies which shown that when people are low in magnesium, they can have insulin resistance, which is also part of the metabolic syndrome. So a low intake of magnesium has been correlated also, other than metabolic syndrome and insulin resistance, it's also correlated with hypertension, Alzheimer's, migraines, and stroke. In my practice, I do put everybody on magnesium because 60% of 60 to even 70% of Americans are not getting enough magnesium in their diet, and they really need this aspect. And of course, many people who suffer with obesity and metabolic syndrome, we know that they have insulin resistance. So this will be really crucial to add to improve for their metabolic health. There are food sources of magnesium, which can be all the seeds, nuts, and grains, even the grains like barley, buckwheat, and even steaks, and garbanzo beans, and lima beans, and soybeans, and spinach, and even avocados. These are all the great plant sources of this magnesium. And to check the levels of magnesium, just checking the serum levels is not enough because only 1% of total body magnesium is outside the cells. So checking the cells, checking the serum levels is not enough. To know the true deficiency, you really have to check the RBC magnesium, which is more inside the red blood cells. So that is an important factor to keep in mind, especially if you're on medications that can deplete your magnesium level is metformin. Metformin can deplete your magnesium levels, always also vitamin B12. So if you are on that medication, really need these two supplemented for you. And I see also magnesium helping a lot with restless leg syndromes, and also it helps with sleep and constipation. So that I can go on and on with the benefits of magnesium. It's really important if you're doing a weight loss program, and if you have metabolic syndrome and hypertension, definitely start taking magnesium. Only caveat with that is if you have low kidney function. Being a kidney doctor, I have seen people who had magnesium toxicity, and there was one case where we even had to do dialysis because that is really not good for the heart. So you do have to be cautious of the hyper magnesium levels. So if you have kidney disease, you really need to talk with your doctor, see if depending on the stage of kidney disease, if you're able to take it or not. And of course, for magnesium also, you do have to monitor the levels. An adequate dose would be anywhere from 200 to 600 milligrams per day for magnesium. Of course, there's different formulations with it. There's magnesium chelate, citrate, and glycinate. Everybody tolerates each one differently. So it depends on what you can tolerate. Okay. The next one is omega-3 fatty acids. Guys, those who are joining now, I did have a test for you guys. I have a prop of my scrub cap. Whoever can guess the answer, what animal is on the scrub cap, will get a copy of the show notes. So go ahead and post it in the comments if you have the answer. So at least I do want to see a healthy set of volunteers who are posting their comments. So all right, so the next one is omega-3 fatty acids, also known as fish oil. They are really important for reduction of blood pressure, and they're also very important for immunity and anti-inflammatory effect. They're really important in an anti-inflammatory diet, and even for people who have protein leakage with kidney disease, we supplement them with fish oil. So again, in my practice, we do start people on omega-3 fatty acids. There's so many. There's 3 of them in there, right? EPA, DHA, and ALA. 3 types of fatty acids or combination become the omega-3 fatty acids. So you can start with taking like 1 gram of 1 gram of omega-3 fish oil per day, and depending on each person or what condition I'm treating, I'd sometimes go up to 2 grams per day. You do have to be cautious. If you're already on a blood thinner, then it can make people bleed more. So you do have to be cautious with that. Of course, it takes several weeks or so for people to see an effect. And there was one study that I was seeing which showed that omega-3 fatty acids were able to reduce the blood pressure in both somebody who has hypertension as well as somebody who did not have hypertension yet. So this is really a good thing, right? And there's no side effects with it. So it doesn't hurt to start omega-3 fatty acids. It can help you with reducing blood pressure. It has an anti-inflammatory effect. It also helps with immunity, and it has that anti-thrombotic effect, prevents any blood clotting. And so the most common side effects I see with fish oil is, of course, the fishy burps, but some people can have GI intolerance, including bloating, nausea, and gas. But otherwise, it's usually everybody tolerates it well. Of course, also another caveat is if you're on chemotherapy, you do want to monitor if you can take the fish oil capsules or not. Again, always check with your doctors before you take any supplements. All right, we are on a roll. The next one here is B complex vitamins. There's several B complex vitamins, right? Some B1 to B12. I'm not going to list the name of all of those here. And those are our water soluble vitamins. They do perform several processes that needed for several processes in the body, including they're part of your neurotransmitters. That means they're responsible for your mood. And especially if you're having issues with depression, anxiety, and those things, supplementing with B complex vitamins might help. They're also needed for immunity. They're also needed for the blood cells to produce the blood. So if your RBC is deficient, if you're deficient in B12 vitamin, you can have different types of anemias. And they're also needed for the gut microbiome. We all know in people who suffer with obesity that having gut health and a healthy gut microbiome is needed. So it's really important to kind of keep those in mind. So they are needed for energy production. They're also needed for producing and again metabolizing the red blood cells. And they are also needed if you have suffering for depression and anxiety. So these would be beneficial for you. You can get adequate B vitamins in several plant sources, especially beans, seeds, and nuts, and whole grains, and meat, dairy, and eggs, mushrooms. Our body is designed to absorb the B complex vitamins more from animal products compared to plant-based compared to plant products. So keep that in mind, especially if you're looking for B12, you get that only from eating your meat, your poultry, and dairy. So if you're a vegetarian or vegan, you got to be careful to supplement the B complex vitamins, especially the B12. And the dosing of this differs for each type of B complex vitamins, so I'm not going to mention that, but it's really needed for several reasons when you're doing a weight loss, because we are changing your nutrition and your diet. We want to make sure you're able to supplement this also adequately for several reasons, as mentioned before. Okay. All right. So, Miss Johnson, you said corgi. Okay, good choice. Good choice there. All right. Last but not least, let's talk about vitamin C and iron. I couldn't separate these two uh, because to have a good absorption of iron, you really need the vitamin C, and iron is one of the trace minerals that we really need to consume in our body. If you don't get it, you're going to have less energy and you're going to be anemic, low hemoglobin. Our red blood cells do need the iron to produce RBC and then to carry all the oxygen. So if people who are low on iron, they will suffer from fatigue, weakness, and of course anemia. And vitamin C is also one of the water soluble vitamins. We do get it a lot in all the food products, especially nowadays. All the food products are fortified with vitamin C, and is of course available in all the citrus fruits. The iron you can get from a lot of plant sources, including your leafy greens, your beans, nuts, and raisins, and seaweed. You also get iron also from animal products too, but the iron is not from the plant products. Again, the iron is not that easily absorbed compared to the animal products. So if you're a vegan or vegetarian, you really need to be watching out for your iron deficiency and may need to supplement. It's especially important for iron is especially needed to be monitored if somebody is trying to get pregnant, and especially in children, because they do have most common cause of they can be more prone for deficiency with iron. The reason is the reason we need look for it in weight loss is that if you're not feeling well overall, and when we change the diet with the macronutrients and stuff, sometimes we tend to lose track of the micronutrients. So I really also keep track of the iron levels, and sometimes people need supplementation with that. Of course, excessive iron levels also can be dangerous. They can have certain conditions called hemochromatosis and stuff. So the ferritin levels have to be monitored. Iron is something which you need adequate levels. You don't need excess levels in your body. So that needs to be kept in mind. Again, before you start any supplements or any kind of things, make sure your levels are checked and make sure you're verifying with your own doctor and make sure it's okay. So guys, if you like this education that we do here, do subscribe and follow us. Subscribe to me on YouTube channel, we have that one too, and follow us on Facebook and share it with your friends. I do want to bring on more of these educational opportunities. Every Tuesdays we're going to talk about weight loss, and Thursdays we're going to talk about wellness, and I'm going to talk about start a new series on Thursdays, mainly talking about hormones. I think it's really important, right? I figured I get asked so many questions about hormones, and that we deal in my functional medicine practice. So I'm going to start a brief introduction to each hormone in the body and kind of tell you guys a little bit how it is important to be maintained and what you can do to help yourself. So join me on Thursdays for talk about hormones. So if you like this, again, like and subscribe. And I'm gonna, after this thing is done, I'm gonna go and look at the answers, and whoever has kept has an answer for me in the comments will get a copy of the show notes. Thank you for joining me today. Take care. If you want to make an appointment with us, go on to our Facebook, go on to the Facebook page and you can look at it, or you can also go on to our website at excelhealthmd.com. Thank you for watching. Take care.